We will see steps of vesicoscopic reimplantation for unilateral grade 4 to 5 VUR. So initially, after establishing pneumovesicum, we inserted the feeding tube. We take a stay stitch first at the ureteric orifice. It can be useful to hold it, but it can also be useful when the ureter retracts down into the hiatus. So we need to mobilize this ureter carefully, releasing all the strands which are attaching there. At this point, one has to be very careful not to damage the ureteric adventitia, and also careful not to damage the vas difference which will be coming in there. So as the ureter gets mobilized, you will get adequate length to cross across. So all the fibers will be teased one by one, and then slowly the strands will be released. And once you have adequate length, there is no need to mobilize some more. But you will see a good amount of ureteric hiatus. So that is creation of a submucosal tunnel. So the submucosal tunnel is created by one side to the other side. In this patient, we are doing a unilateral reimplantation. So we are not going to create a second tunnel. So we are creating a tunnel from the left side to the right side using the instrument, and then the right ureter, which has been mobilized, will be brought to the left side here. So once the ureter stays mobilized properly, it will stay in position nicely, and we have to close the hiatus there. So we have to take 2 or 3 sutures with the 5-0 vicryl to close the hiatus. This is an important step because this is only one which is going to prevent the reflux in addition to the submucosal tunnel. So once this is done, you also will have a pneumovesicum stabilized, because it won't be leaking into the hiatus there. So 2 or 3 sutures are taken, and when we do the final stitch, we also take anchoring stitch from the adventitia of the ureter, so that the ureter doesn't retract there. So that hiatus has to be closed nicely. So in this patient, only unilateral reimplantation is there. So the other ureteric orifice is well away down in the trigone. We have excised the edematous tip of the ureteric orifice, and the ureteric opening is now matured with the 2 or 3 interrupted sutures. And once that ureteric orifice is matured, we have to insert a double J stent from one of the suction cannulas. We also have to close the mucosal defect which was there from the original hiatus. So that is again closed with the 2 or 3 interrupted sutures. So once this is done, we'll be ready to pass double J stent. So in this patient, only one double J stent is kept. The other ureter is not refluxing, so we are not keeping a stent on the left ureter. So that is the end of the procedure. So Foley's is kept. Thank you for watching this video.